Hello everyone, I'm Dr. Tefia Debbie. I'm a consultant psychiatrist and a psychologist. I do videos on mental health and self-development education. My goal is to help demystify mental illness and provide you with self-improvement tips that will help you be your best and live your best. In my last video, I talked about 15 signs to identify if your child or adolescent has a conduct disorder. In this video, the second on the two-part series on conduct disorder, I will focus on 8 helpful tips for parents to address the issue of conduct disorder. There are several factors that have been associated as probable risk factors for the development of conduct disorder. This includes genetic factors, frontal lobe damage, which could also be as a result of a genetic factor, child abuse, use of alcohol or other substances by parents, dysfunctional home, extreme poverty in the home. These are all factors that have been associated with the development of conduct disorder. Now, children with conduct disorder often find it difficult to empathize or feel some level of remorse. They find it difficult to show feelings or emotions towards other people, and they also find it difficult to perform well in school, and they often blame others for their shortcomings. Effectively managing conduct disorder will therefore require a multidisciplinary approach, which just simply means that it will require the involvement of possibly the therapist, the school system, or the teachers, and particularly parents. So in this video, I'm just going to talk about 8 helpful tips that parents can use to help address the issue of conduct disorder. Just know this, it will require a multidisciplinary approach, it will require time, and also it will require you as a parent to be involved to get good results. First helpful tip is educate yourself. I often say you cannot change what you do not realize, or what you've not identified, or what you've not recognized. So you have to educate yourself about conduct disorder. I guess my first video will be helpful in case you don't know what to look out for or how to diagnose if your child or your adolescent has a conduct disorder. So don't be in denial. Denial is not helpful, or just waving it away is not helpful. The first thing is educate yourself. The second helpful tip is be clear about rules, about expectations, and about consequences. Here you want to keep it simple. You don't want to keep it lengthy. Between 5 and 10 rules is more than enough. And you definitely want to give rules that are easier to achieve, not things that are so complex or very difficult for the child to achieve. For example, you want to give rules like I keep my hands to myself. You want to give rules like I clean up after myself. I do not raise my voice when I'm talking to others. I do not interrupt other people when they are talking. You know, simple rules, things that are easy to achieve. Third helpful tip is be consistent in following through the rules, the expectations, and the consequences. This is so important, because when you fail to be consistent with what you say you are going to do in terms of the expectations and the consequences, the child begins to think that maybe these rules are up for negotiations. I know it can be difficult to hold your ground, you know, especially when you do wrong, and to implement that and want to say, okay, I forgive you, or just let it go. But you would not be helping them with appreciating the power of consequence. So you want to be consistent and hold your ground. Fourth helpful tip is you may need to attend to other coexisting mental health conditions. It is not uncommon that people with conduct disorder have other coexisting mental health conditions. For example, it could coexist with attention deficit disorder. It may coexist with anxiety and depression. It may coexist with substance abuse. So you really want to also attend to the other conditions and not just put it under conduct disorder. You want to address those other coexisting mental health conditions. Fifth helpful tip is that you may want to discuss with the provider. You want to contact and speak with a specialist. There are various treatment protocols that can be helpful. Cognitive behavioral therapy, psychotherapy, parent management training. So you want to discuss with your provider, a professional, on your treatment options as regards how best to help your child or your ward. Number 6, you definitely want to practice this new skill. So when you go through the parent management training, or you do CBT, or just you have conversations in psychotherapy, there will be new skills that will be spoken to you about. These skills, you would want to share them with the child's teachers and other people involved in their life. And you also want to discuss this treatment techniques with your child as well, and you want to practice them. The key is to practice them. The result is not in knowing them, the result is in the actual practice of these new skills that you acquire as you go through discussing with the provider and the therapist. 7th helpful tips is that you may want to consider medication. Now, medication is not the mainstay for conduct disorder, so there is really no medication that you give to address conduct disorder. But remember, I did mention that one of the things you need to do is address the other coexisting mental illnesses. So for instance, if someone has attention deficit hyperconnected disorder, I do have a video on that, a previous video on that, on the signs and the symptoms and how to recognize it and treatment options. You may want to use medication to address such things. You may also want to use medication to address other things like depression or anxiety that may coexist. So there may be need for medication in the management, and just be open to it. The 8th and the final tip is be present and be patient with your child. Now, it's very important because, you know, children with conduct disorder will often be reprimanded, will often be spoken to and spoken of in a bad light. And you need to be patient with your child. Be able to identify those moments where they do things that are right and praise them for it. You know, all of us respond to appreciation. Now, it's very important you appreciate them and you praise them for what is right, not for what is wrong. Remember, I said be consistent, so do not negotiate when they have to pay the consequence of their actions, but do not also fail to be present. And it's not for you to just let them go and let the therapist take full charge of their treatment, but you need to be patient and you need to be present in the course of their life to help them through the process. I hope this video has been helpful. I hope you've learned some things, and I hope you will also practice like I talked about in the 8 tips. Just in case you have not subscribed already, please do so. That way you don't get to miss out on any of our subsequent videos. Thank you very much.